We already have a shortage of primary care docs, only projected to accelerate. And this bill discourages people from wanting to become primary care docs because, as far as I can tell, we only want people with inherited wealth or something to become doctors because this is a very expensive education. Can you talk at all about how this bill will impact people's ability to go to medical school?
Absolutely. And especially specializing in primary care and family medicine, we had 800 family medicine residency spots go unfilled last year because there is no incentive to go into primary care. And when I'm having candid conversations with medical students, it is hard to convince them to go into primary care, especially now. And I'll tell you why. It's really expensive to go to medical school. First, you have to get an undergraduate degree, cost you around $100,000 or more. Then you have to go to medical school, which going to medical school can be upwards of $400,000. Let me give a little bit more background. There's something called the Public Service Loan Forgiveness Program. And this has been the lifeline for people, especially who go into primary care, because primary care is a lower paying specialty. It used to be that while you were in training, the months that you spent in training making payments would count towards the 10 years that you need to give back to a nonprofit organization, such as a hospital, in order to get loan forgiveness. Now, your time in residency does not count anymore. That is very destructive to primary care. It's actually destructive to all of the specialties where none of that time counted towards your loan forgiveness. And this entire time, you don't just have that $400,000 in debt from medical school, you're paying a 6% interest rate on that as well for even having borrowed that money. Let's not forget that they even capped the amount of graduate loans you can take out now. So the full amount you can take out is $50,000 every year for a maximum of $200,000. And as I previously mentioned, just going to an in-state school like I did, I went to VCU, that was $280,000. Where was I back then supposed to get that extra $80,000 just to be able to attend school? Well, I would have had to go to a private loan agency who could have predatory interest rates upwards of over 10%, much higher than the federal interest rates. In order to become a doctor, you already have to have money given what just passed. If you're coming out with $280,000 in debt, add 6% onto that, the time and training doesn't count towards your 10-year repayment, and then you're making a lot less money as a family doctor, you're going to be paying off your loans for your entire career of upwards of 30 years.